Omeprazole by Ruby, Ritter, Heather, and Veronica.
Have you ever experienced heartburn?
Not really.
No, it's where your chest just burns and it hurts. It's a burning sensation.
Oh, maybe you're suffering from gut or stomach ulcer, with the spicy food.
Yeah.
Eating spicy food or acidic food can cause GERD, heartburn, or even stomach ulcers. Omeprazole can help relieve those issues.
So let's talk about a common medication. It's called omeprazole.
Alright, let's talk about what omeprazole is, what it's used for, the drug interactions, and what patients to know before starting the medication.
Omeprazole is a part of a class known as proton pump inhibitors, also known as PPIs.
Okay, and also I heard it's a work reducing amount of acid your stomach make.
Omeprazole works by reducing the amount of acid your stomach makes.
It's super helpful for people with conditions like GERD, stomach ulcers, and even ulcers caused by insects like Tylenol. This also helps patients who suffer from Zollinger-Ellison syndrome, which is a disease in which tumors can cause stomach to produce too much acid, resulting in ulcers.
Omeprazole usually comes in a delayed release capsule or tablet, and it's usually taken orally once daily before meals.
Cut!
Just like all medications, omeprazole does have side effects. It includes stomach pain, nausea, and diarrhea. And I also heard on if you use that medication for a long term, it also causes some issues like low magnesium, vitamin B1 deficiency, and also increase the risk of bone fractures.
Like all medication, omeprazole has side effects. Okay? The common ones include headache, nausea, and stomach pain.
It also interacts with other drugs such as clopidogrel, and omeprazole reduces its effectiveness. Certain antifungal medications like ketoconazole and warfarin may increase bleeding risk.
Long-term use can cause bigger issues, like low magnesium levels, B12, deficiency, or even increase the risk of bone fractures.
When you guys are going to start taking omeprazole, you guys should always check with your doctor or pharmacist before taking it, especially if you guys are on blood thinner or anti-seizure medications.
Always check with your pharmacist or doctor before taking it with other meds, especially if you're on blood thinners or anti-seizure medications.
Here's what patients should know when taking omeprazole. And also, take at least 30 to 60 minutes before meal and usually in the morning.
You guys should tell your doctor if you guys are pregnant or breastfeeding before taking omeprazole because it may harm your baby.
And remember, it's usually not used for long term unless advised by your doctor. Taking the medication for long term can lead to deficiencies and even infection risk. And also keep an eye on some serious side effects like abdominal pain, progestin vomiting, and black stool. Notify the doctor immediately.
Remember, it's usually not meant for long-term use unless advised by a doctor. Using it for too long can lead to deficiencies and increases the risk for infections like C. diff.
So if you're dealing with heartburn or ulcers, omeprazole might be the answer for you.
And remember, always follow your doctor's directions and don't stop taking it suddenly unless advised by your doctor.
So always remember to stay informed, stay healthy, and stay acid-free.
You're going to need an omeprazole after that.
Alright, so remember, whenever you eat any spicy food or anything, you should always take omeprazole, especially if you experience GERD or heartburn. But you should also check in with your doctor and make sure it's okay so you don't have any drug interactions.